Welcome back. I have Dr. Caroline McGugin of Mobile Bay OBGYN in the studio now. You know, October is Breast Cancer Awareness Month. So we're going to talk about prevention, the risk of breast cancer. Thank you for stopping by. So in terms of breast cancer, we like to think of it in threes. You've got the risk, how to reduce your chances, and screenings. Those are three important keys. When it comes to cancer prevention, you know, talk about what people can do.
So breast cancer is very common. 1 in 8 women in their lifetime will be diagnosed with breast cancer. Most of the things that increase your chance are things that we can't necessarily prevent. So being female, getting older, genetics, family history. There are some lifestyle things that can help decrease that chance. One of those is being a healthy weight, and then also exercise. We know that women who are consistently active have a decreased chance of getting breast cancer.
It's amazing. Exercise is connected to so many things in our well-being. Just another reason to get out there and just walk if you can. I want to talk a little bit about the screenings though. When should women start that? I guess it depends on your risk factors.
Exactly. So it's really important to know your risk. If you have an average risk of getting breast cancer, then you should start getting your screening mammograms when you're 40 and get one every year. If you're at high risk, and so particularly if you have a strong family history, you found out that you have a genetic mutation that's linked to breast cancer, or if family members were diagnosed with breast cancer at a young age, those women should often start their screening mammograms before they're 40, and they might also benefit from doing supplementary imaging, so like breast MRIs and things like that.
Okay, so how do you know though if you're at high risk, say if you don't know all of your family history?
So family history is certainly a big part, and if you don't have any idea of your family history, we actually talk about maybe you should get genetic testing and find out. Otherwise, there's things in addition to family history that can increase your risk. So if you've had breast biopsies that have showed atypical cells, things like that. And there's a risk calculator. So when you go get your mammogram, they'll ask you, you know, what is your family history if you know it? Have you ever had a biopsy? They're asking you all these questions. And they put it in a calculator along with things like your age and your breast density, and it comes up with what your estimated risk is. And so when you get your mammogram report, it will have that number. And if your estimated lifetime risk is over 20%, then you're considered high risk.
And I know this weekend you have the Making Strides Walk, and you're the featured speaker for that. The focus, you say, this time is?
It's really about, you know, the sense of community and having, you know, this is a wonderful event. My family, we love going to it. There's something special about having so many people out there that have all been affected by breast cancer in different ways. And that's a very supportive community.
Yeah, you need that support when it comes to cancer.
Yeah. I think when you can take something that's as hard as breast cancer and be doing something good, raising money or raising awareness, that can feel very empowering, and it makes it a really important and successful event.
Thank you for stopping by.
Thanks for having me.